So, good evening, everybody, and welcome to the Facebook Live of Xenith Advanced Fertility Center. I am Dr. Mamta Dighe. I am the director of Xenith Advanced Fertility Center. We are based in Wakad, PCMC, as well as in Korika Park. I have been into doing infertility for over more than 25 years now. I started doing infertility with Dr. Kamini Rao way back in 1999 and have only exclusively been doing infertility since then. And it's been a journey for me as well as, for Xenith to look at how infertility is changing, how treatment patterns are changing, how people's approach to infertility and people's approach to treatment is changing. And I felt that this is an apt time to talk about some things that I feel are of concern even today. Because unless and until awareness is created regarding a problem that persists or probably is even increasing in magnitude, not only in our country, but globally world over, people will not really understand how to go about things. And that is the reason that I have chosen this topic about why we need to talk about infertility proactively. So without, much ado, let us just delve into this topic. And at the end of the discussion or our Facebook Live, if you have any questions, queries, anything that's bothering you, you can just send in your questions in the comment box and I will be glad to answer all of them. At the same time, if you feel that you want to send us your queries on our email, I will be giving you our email ID at the end of this talk and you can send in your queries there as well. So let us begin. Now, basically, if you look at the definition of infertility, it is a retrospective diagnosis. So what does infertility, how is it defined? Infertility is defined as absence of conception if a couple has tried for a year or more without the use of any protection. That is, if you have not really used methods to delay or avoid pregnancy and have been open to having a pregnancy and not been able to get pregnant for a year, then this can get defined as infertility. So when we look at this, automatically it means that infertility is a retrospective diagnosis. So unless you have spent that time, unless you have spent that year trying, you are not really going to know whether you're fertile or infertile. And because the diagnosis of infertility becomes more or less retrospectively, we have gotten into this method of kind of being reactive to infertility. So only if you get a diagnosis, then we start rushing and seeing a fertility consultant and trying to understand what is happening. But we do not proactively think about or talk about our fertility, individual fertility status. Now, what happens is after a couple gets married, usually there is family planning which happens amongst all couples. Now, family planning is not necessarily just use of contraception to delay a pregnancy. Family planning could be, your decision, your timelines to understand when and how you want to conceive. What are the current scenarios that are playing out in your life? Your the job conditions, what you want to do, financial conditions, relationship conditions. There are so many things that are different and happening very newly in a couple's life that family planning gets just kind of constricted only to thinking of how to delay a pregnancy. But hardly any thought is given to the fact of whether the fertility index or the fertility quotient of a given couple, the reproductive potential of the woman and the husband is good. Is there a good chance of conception for this couple? Are there any issues that may cause problems in fertility for this couple? These kind of issues are never given a thought whenever the decision to plan a family comes up. So what happens is, based on the job conditions, based on the relationship conditions, current scenarios, financial conditions, and the decision of a couple to give time to each other, the decision is made as to when they would want a pregnancy. And of course, at the other hand, there are always parents and in-laws and friends and other relatives who are constantly pestering and asking about when you want to plan a pregnancy. And more attention is given to how to keep those people at bay, and then try and decide that maybe after 2 years, maybe after 4 years, that is the time that you want to have a baby. But many a times what happens is that the fertility potential of some couples is already compromised. There is a possibility that the woman is suffering from polycystic ovaries. There is a possibility that the woman is suffering from a low ovarian reserve, or there could be other issues as well. At the same time, there is a possibility that there is an issue with the semen analysis and the sperm count or motility in the male. Now, these conditions are never given a thought. It is presumed that every couple, after getting married, whenever they would want to try for a pregnancy, would conceive naturally without any problem. And this is where the issue happens. What is important to understand is that whenever you decide to plan or delay or make a decision about when you want to plan your pregnancy and childbirth, it is also important to understand what your individual reproductive potential is. Because even though people are feeling much more younger, like they say 40s are the new 20s, but especially in women, the biological clock continues ticking. And women, and this is something that I really want to bring forth, and I do talk about it a lot in some of my talks or the Facebook lives that we have. Now, as women, we are born with a set number of eggs in our ovaries. Throughout our life, and especially throughout our reproductive years, we keep utilizing the number of eggs or the oocytes that are already present in this reserve pool that we come with, and we keep depleting that pool because we are utilizing the eggs from the ovary. And over a period of time, these eggs will keep reducing, and finally, after a certain period of time, every woman will deplete her ovarian reserve or her pool, and hence the ovaries will undergo, they'll become small, and ultimately women will achieve menopause. Now, what is important to understand is that the function that the ovary needs to do in order to have a menstrual cycle is different from the function and the ability that the ovary needs to have in order to give a pregnancy. So, even if there are less number of eggs in the ovary, the menstrual cycles could be perfectly normal month to month without the woman even getting a clue of having less eggs in her ovary. And it is similar to when we talk about health or stamina, or when we are doing a stress test about how the heart is functioning. What you need to kind of exercise or walk on a flat area is going to be very different from the kind of energy and the stamina and the function of the ability that the heart has, or the reserve that the heart has, that needs to be used at an incline. So whenever you need to do extra work, you need to have a good ability and good health of that particular organ. So the ovary may continue functioning well in order to keep giving proper timely menses, but may not have the capacity to produce a good quality egg that can lead to a pregnancy easily. And this ovarian reserve, or the pool of eggs that women have, varies from a woman to woman. So every woman, irrespective of what age she is, like every 25-year-old woman is not going to have the same ovarian reserve. Every 35 is not going to have the same reserve. So age is an independent criteria to understand your reproductive potential. But over and above that, the ovarian pool or the ovarian reserve is another independent criteria to understand whether there is a good reproductive potential in the woman. Now what happens is that every month when the egg gets ready, along with an egg which matures, there are a lot of eggs which undergo apoptosis or atrophy, or they die, let's say in plain simple language. So basically, it's not just one egg that you are losing every month. You're losing quite a lot of quantum or quanta of that egg reserve that you are having every month. So a woman who has a low ovarian reserve will not even know that there are less eggs in the ovary, and inadvertently, if this particular woman and the couple plans on delaying the pregnancy, let's say for 4 years, at the end of 4 years, her ovarian pool or reserve would have declined much more than what it is as of today. Hence, knowing what the ovarian reserve is, what is the pool of oocytes that a woman has before deciding to delay a pregnancy, may really help the couple to take an informed decision regarding whether postponing a pregnancy may be a good idea for them. So it is important to sit and talk and understand the reproductive potential of both the partners, both the people involved in the couple, the male as well as the female, in order to decide what is to be done. And this is what I mean when I say that we need to talk about fertility proactively. So we need to address our fertility the way we address or look into other issues or other health concerns. So we do not nowadays really, start looking at, have a full blown up diabetes or have a full blown up very high cholesterol levels. We try and screen our population. We look at the sugar levels proactively. We look at the cholesterol levels proactively. In women, we screen for certain cancers. So we are doing that so that our health is maintained, because prevention is going to be better than cure. But the same idea or logic is not applied in cases of infertility. And infertility becomes a retrospective, reactive kind of medicine, let us say, because it is only after one is diagnosed that one starts thinking that if only I had known before, I would have been able to do something about it. I'm talking about this subject because a lot of women and couples who come to me have expressed this, particularly saying that if only we had known that, this was a concern, if only there was a method to understand, I probably would have planned my pregnancy much earlier. And then I would not have had to either go through treatments, and I would have had the ability and the chance to have my own biological child. Because it is so important, and it is known that infertility, the trauma of infertility, can really be quite a bit. In fact, the trauma of infertility has been likened to the trauma that a patient may undergo when cancer gets detected. So if we are facing an issue which could have so many problems or effects on our life, it could be a good idea to understand whether our fertility potential is good and then make a decision regarding how we can plan the pregnancy and childbirth. So how do we go about this? I think the first thing that couples need to do is understand that there is a biological basis to understanding the fertility potential of each individual couple. It is not just based on age, not just that, it's only after 35 that a woman has to start worrying, but a 30-year-old woman could sometimes have an ovarian reserve which is much lesser than a 35-year-old woman also. For that matter, even a younger woman could have a much lower fertility potential compared to an older woman. Another important thing that I would like to address is that research has shown that Indian women are aging much more faster in terms of their ovarian reserve compared to Caucasian counterparts, which means the fertility potential of, let's say, a 35 or a 36-year-old Caucasian woman matches the potential of a 30-year-old Indian woman. So Indian women inherently, for some reason, and we do not know whether it is genes, whether it is nutrition, whether it is stress, whether it is pollution, we really don't know the reasons behind this, but the ovaries of Indian women are aging faster. And hence the cutoff that we take of age 35 for Caucasian women, or something that has been done over ages, that generally we say that any woman who goes above the age of 35, she should start getting more worried or concerned about her pregnancy. But it could be that for Indian women, the cutoff could be 30 or 31. And with delay in the age of marriage, delay in the time that pregnancies are planned nowadays, with women and everybody, getting educated more, getting into higher and higher positions in their careers and their job, it is no wonder that pregnancies are kind of getting pushed a little further. And it is in a way not fair to, say that keep everything aside and just plan a pregnancy. But it is also important to understand that if pregnancy is something that is so close to our heart, because if you look at it, it is an innate desire, not just in human beings, but across the animal kingdom. Because, the desire for offspring is going to come up. There are going to be extremely few individuals who may not really feel the desire of childbearing. So if this is going to be an as equal part of our life as is our job and our careers, it is important to understand the time frame that biology and our body gives us for childbearing. And that is the reason that women, especially women, even men for that matter, but especially women, should be proactive, should start understanding their body, should start looking into how their menstrual cycles go, should also understand that their fertility is not just based on how well the menstrual cycle is going, but especially if there are irregular cycles, if there is heavy bleeding, or if there is less bleeding, or any other issues where if there is any intermenstrual bleeding, if there is continuous spotting before bleeding actually starts during their menstruation, all these could be telltale signs of the ovary not functioning at its optimal best. And if that is a problem that a woman comes across, and I'm not saying that if women come across this just once in a while, the body is not a robot. So obviously every woman is going to have an irregularity once in a while. But if you have menstrual cycles which are generally as a pattern irregular, if you notice that the flow during menses has started coming down, or if there is heavy bleeding or there is a lot of pain during period, then this is something that you must discuss with your gynecologist or your fertility specialist, because that could point to an ovarian dysfunction, and the earlier you find out regarding that, the better it is going to be. So these are some of the reasons why women should be proactive, couples should be proactive and try and understand what their individual fertility potential is. Now, till a few years back, we did not really have any tests that could tell us what is the individual ovarian reserve of this woman. When I started practicing infertility in 1999, we did not have this test. And we would just go by the tests that were available and do sonographies, and sometimes feel that, oh, all tests are looking fine, but the ovaries are not looking very healthy. But we did not have a method to really quantify what kind of a pool of oocytes this woman is carrying. And hence, it was difficult to understand whether this woman has a good fertility potential or the reserve in this woman is decreasing. But since the last many years, we have a very good and reliable test that can tell us what kind of an ovarian reserve an individual woman may have. And if one can try and get and understand the ovarian reserve before deciding to kind of really delaying pregnancy for many years. I'm not saying, delaying a pregnancy just for a year or so, but we are seeing a lot of couples who get married and have delayed pregnancy for at least a minimum of 5 years or 6 years. And by the time they come to us, because now there is no conception, we realize that the number of eggs in the woman's ovaries has really declined. Now, if this woman knew that she has a low ovarian reserve upfront, maybe 5 years back, she would have had the ability to decide that probably I will not delay my pregnancy for 5 years, maybe I'll delay my pregnancy for 2 years or maybe 1 year, and work around the other things in my life according to what my biology is telling me. So this is the advantage that being proactive and understanding your own body and your own menstrual cycle and your own ovarian reserve will tell you. One need not panic. One need not start getting worried every time or, thinking that everything will be wrong. But if there are specific conditions which you feel are going to make you delay your childbearing for quite a few years, then it may be a good idea to first try and understand where you stand vis-a-vis your fertility potential before you decide to delay this pregnancy. I've also discussed some of the telltale signs that you could have, along with problems in your menstruation. If there is excessive weight gain, if there is a lot of hair loss, if there is a condition where you see a lot of facial hair growth, and other issues, if there is dysmenorrhea, lot of pain during menses, all these things could be directing you towards a problem in your reproductive hormones, and that is the time you could probably meet up or consult your gynecologist or your fertility specialist and then take a call regarding where you stand vis-a-vis your fertility. As regards the male partner, it is usually said that the effect of age on women is much, much more on her reproductive potential compared to that with the man. And it is true, because if the semen analysis is normal, then usually even for a 40 or a 45-year-old man, the sperm counts and motilities are usually quite good. Yes, there can be some abnormalities which may increase in the sperms once the age crosses that limit, but usually under the age of 40-45, in a generally normal semen analysis, age will not cause that much of an effect. However, what is being seen is that the male infertility is also on a great rise in India and globally. Now, this could be because of changing lifestyles, it could be because of pollution, it could be because of stress, it obviously could be because of global warming. Because there was a study which was done of course, it was done in animals, and it was seen that even an increase of about 2 degrees caused a problem in the sperm count and motility. So all these variables are not necessarily something that has to do only with that particular man, because we are all breathing the same air. We are all exposed to the kind of environmental problems that are happening globally. And the effects of those may have an issue with the sperm count and motility, even if the man is maintaining a good nutrition and a good exercise regime. Under such circumstances, there could be certain men in whom the testicular function has started declining, and the hormones that kind of are important, the reproductive hormones, kind of are not in balance in order to give good quantity and quality of sperms. Because again, this has started affecting men in such a large extent, it could also cause a problem if men delay their fertility for a very long time without taking an insight or without getting an insight into what kind of sperm counts, motilities, and the semen analysis that they have. These two factors, the gametes, what I am talking about basically is from the point of view of the eggs and the sperms. When we address a couple for fertility, there are 4 basic factors that we look at: the eggs, the sperms, the uterus, and the fallopian tubes. The fallopian tubes are 2 tubes which are placed at the side of the uterus, and these tubes help in the transportation of the egg and the sperm. It is in the tube that the egg is fertilized by the sperm and an embryo is formed in the tube, which is then transported by the tube into the uterus. But what we are discussing here is mainly got to do with the eggs, the ovarian reserve, and the sperms. So the 2 factors out of the 4 are the ones where delay or time is going to play a major role. And if we kind of can get an assessment into how the eggs in the ovaries or how the sperms are, it would help the patient to take an informed decision. A new thing that has come up, and I would just like to touch upon that, is that there are women who may not be married, who may want to still plan or delay delay getting married or delay getting a baby, but have a low ovarian reserve or are at a risk of a low ovarian reserve later on. In these women, today we even have social egg freezing. So what we do is that in women who want to attempt a pregnancy later, we kind of stimulate the ovaries, stimulate and form more eggs. These oocytes are retrieved out of the body, and the mature oocytes are frozen. So they are frozen by a process called as vitrification. And then whenever the woman or the couple wants to plan the pregnancy, these oocytes, which have been frozen by the IVF technique, are retrieved, they are cooled or thawed, and then these eggs are used in order to have a pregnancy. This helps because if the woman has a certain reserve or pool of eggs today and she wants to plan a pregnancy, let's say 5 years later, then, and she's approaching and she is aging, 5 years is going to take her, let's say from 31 to 36 or from 35 to 40, and she already has a low ovarian reserve, then by the time she is post 5 years later or 6 years later, she is not going to have the same cohort, the same number of oocytes in her ovaries as she has today. So what is done is that those oocytes are taken out and are preserved today itself, so that they can be used at a later point in time. The advantage being is that you get more number of oocytes and you get much better quality of oocytes, because the woman is much younger when these oocytes have been frozen. So with the technology that is available today, two things have been made available to all couples. One is getting an understanding of their ovarian reserve, and the second thing is the ability to preserve their gametes, so that if there is an influence of age or time on these gametes in the quantity and quality, then the same gametes which have been preserved many years back can still be used in order to have their own biological child. Now, even though one may not have to do all these things, and of course, always the first and the best option is always a natural conception. But what is available, what technology is there today in order for you to make whatever is there in your hands, use whatever is there in your hands to ensure your own biological child? That information, having that information is an extremely crucial part. In today's day and age, when the technology, information technology is so widely used, nobody should have to grapple with the problem that today their ovarian reserve is very poor, and if only they had known this years back, something could have been done in order to preserve their oocytes and in order to have their own biological child. And that is the whole essence of talking about fertility more proactively. Not just talking about which contraception is to be used, because fertility is not contraception. Just as medicine is not illness, just as we need to pay more attention to our health and wellness rather than to take treatment for diseases, the same is true for infertility, wherein we need to protect our fertility rather than start taking treatments for infertility. Though we are an infertility and IVF center, I think the most important thing that we can do for our population and for our women and for our couples is to educate them so that they do not need to take infertility treatments. That is the best thing that we can get across. And if we can take care of our nutrition, if we can take care of our exercise, if we can take care of our stress levels, and if we can manage and understand and gain information about our own reproductive potential, I think we would have done a good job for our own reproduction and be able to kind of stay away from treatments and stay away from coming to fertility clinics for that matter. And just make sure that we do not go through a lot of stress in our conception, because it is meant to be a natural and a happy process, and if we can keep it that way, I think that would be the best thing to do. So my advice to couples is to first and foremost take great care of your health. Your general health is extremely important. I cannot start emphasizing the importance of diet and exercise, not only on general health, but on reproductive health as well. The second thing is talk proactively about your fertility. Discuss your problems. If you have any issues with menstruation, if you have any telltale signs that are pointing towards a hormonal imbalance, discuss it either with your parents or your friends or your siblings or your doctors, because it is important to nip the problem in the bud. The third thing is, even when you get married and you want to delay a pregnancy, especially if you want to delay a pregnancy for a longer duration of time, try and understand whether it is safe for you to do so. Whether delaying your pregnancy for a very long time could cause problems later, could mean that you may have to struggle with infertility and take treatments in the long run, then it is better to get that information a priori, ahead of time, and only then plan a delay in your conception as what your biology is telling you to do. That is the third thing. But this will only happen when you start discussing what you want, when you understand that there are ways available to understand your own individual reproductive potential. And we look at fertility more than just, using contraception and how one can delay pregnancy. And of course, if you have any questions, any queries, or you wish to understand where you stand vis-a-vis your reproductive potential, you can always visit your doctor, or you can visit your fertility consultant, or you can give us a visit at Xenith and get an understanding of where you are. I believe that any infertility or fertility, we don't call ourselves an infertility center. The success of a fertility clinic is based on how many people who visit the clinic go away and get pregnant. Just get pregnant, not get pregnant, and not just look at what your IVF success results are. We need to look at what your success rates are. Even if we can tell people that just go home and try naturally, you really don't need any kind of treatment, I would say that also is the success for that fertility clinic. And the more and more we can do that, the better and better it is going to be. So all I want to tell all my viewers is that discuss your fertility proactively. Do not just make it a retrospective, reactive kind of treatment method, because like we all know, instead of rushing or trying to get a cure, if we can prevent these issues, it is going to be much, much better for all of us. So I have tried and given some kind of insights into what I mean by this. Of course, there are so many other things that one can look into and then plan how they would like to decide on their pregnancy time, depending on their logistics and their life situations. Those can be looked into as well. As long as we start doing this, as long as we start understanding that there is information out there and you can seek it in order to have a much better understanding, that would be the first step. So thank you so much, all of you, for joining us. I would just like to give all of you our email ID so that in case you have any questions, you can write to us. Our email ID is info, info @Xenith. Xenith is with an X, Xenith, Xenith.clinic. Please do follow us on Facebook and Instagram. And if you have any queries, and if you have any questions, or if you have any topics that you would like us to, throw some light on, you please feel free to write to us about them so that we can address those issues for you as well. If there are any questions right now, please go ahead and post them in the chat box, and I'll try and answer them as much as I can. Thank you all of you for being here, and do join us, follow us, and we are always here for any of your concerns that you may have. Like I said, we are based at Wakad. This is just near Kaspate Sauk at Wakad, and we also have a branch in Koregaon Park, which is opposite German Bakery. So if any of you who need to visit us in person, please feel free to call us and fix an appointment and come and meet us there as well. Thank you so much, and have a great weekend ahead, all of you.